New numbers this Friday morning from New York City. There are nearly 50,000 cases of COVID-19. To put that in perspective, that's enough people to fill the Frank Irwin Center here in Austin 3 times. More than 10,000 are hospitalized, and the most staggering deaths are approaching 2,000 people. That state's governor begging for healthcare workers to flood into the state, and some Central Texas nurses are answering that call. Less than 72 hours ago, a St. David's nurse practitioner boarded a plane to New York City, is there now. I got to speak with her just before she started her 12-hour shift. That's what she's working now. Here's what she's saying on the front lines.
Please help. We need personal protective equipment. They've heard it over and over again, but keep crying out for us. I'm seeing nurses coming back from the hospital that don't have what they need, and they're getting infected. There were 3 last night that were from Kentucky that are being isolated currently. This is true reality. It's not some sort of a fictitious story.
That's the story of Allison Arnett, a St. David's nurse practitioner who flew into New York on Wednesday.
I'm in Manhattan. I am fairly close to Central Park in location as far as a hotel that has been commandeered for all of the health providers. And basically, we're sent out to all over the city. They have, different assignments depending on if you're a nurse practitioner, a PA, an RN, lots of critical care nurses, of course, and emergency room experience. Different things we're taking all. We're all taking those assignments and headed off to wherever we're called to.
Good morning, and day 2 it is. I am dressed and ready for work.
A call to the front lines in this modern medical war.
We can't keep up. We can't keep up.
And are you working directly with patients who are coming in with some of those severe COVID-19 symptoms we're seeing?
So right now I have been sent to a large hotel that has been changed over because there have been these smaller group homes of people who are high risk. They're elderly, they're some dementia, some mental issue of some sort. And so many of them don't know what's going on.
Any help is welcome help for the unimaginable need.
New York City is struggling. Obviously, you see it on the news with the number of deaths and the number of cases, but we can't run from this.
Warning Central Texas could be next.
I got to see some of the preparation that was getting put in place before I left there. The hospitals, I work for St. David's and Ascension, from what I understand, is just as connected in the planning. They are planning, and they have amazing contingency plans that they've already put in place. But the truth is that we can't run from this virus.
The truth is coronavirus is contagious, as is the fear and panic, love and joy. She says, choose wisely.
How do you hold on to that faith? How do you keep going?
Recognizing that we each hold our God within us. And if I can see that God in you, the people that I'm with around, either caring for patients or the patient, when I look into their eyes and re-encourage them and give them that sense of peace.
Just so inspiring seeing our hometown heroes stepping up to the front lines. Now, Arnett is video blogging all of her days in New York City on the front lines of COVID-19. If you'd like to visit that website, it is on your screen.